Good evening, ladies and gentlemen. Welcome to the Battling and Beating Cancer Show. I'm Scott Seaman, the not-so-good-looking guy on the screen, and next to me is the beautiful Charlene McMann. We are co-founders of Chicago Blood Cancer Foundation, and we're thrilled and delighted to be back again for another season of shows. And I know that cancer is not the most entertaining subject for everybody, especially after they're done with dinner and in the middle of dessert. But Charlene always tells us that more than 1 out of 2 men and more than 1 out of 3 women in America will be diagnosed with cancer during their lifetime. So the rate of incidence is pretty high overall. And a lot of people say, well, my God, if I get cancer, that's the worst thing in the world. And study after study shows that that's the number one fear among Americans is a diagnosis of cancer. But the good news is it is not a death sentence. More and more people are living longer and longer, and there are so many things that you can do to improve your outcome that it's a lot different than it was years ago because of research and what this show is all about, battling and beating cancer. And at Chicago Blood Cancer Foundation, our commitment is to curing lymphoma, leukemia, and myeloma. And these are the blood cancers. There are other types of cancers, but basically you have blood cancer, you have breast cancer, which is a solid type of cancer, which we're going to be talking about tonight, and we also have skin cancers. So we're going to cover all types of cancers during this series. On next week's show, we're going to talk about lymphoma. The week after that, leukemia with Dr. Stephanie Gregory at Rush University Medical Center. But let me just tell you that one of the things that Charlene is, in addition to being the Jefferson Award winner, which is a Nobel Prize for Public and Community Service because of all the fabulous work she's done for people with cancer, co-author of the Battling and Beating Cancer book. And for the first 2 people that call us at the number Charlene will give you in a couple minutes and leave your name and your full address, we're going to send you out a complimentary copy of this. So it's an exciting show today. We're talking about breast cancer. And Charlene, let me turn it over to you.
Well, thank you, Scott. Yes, welcome. It's good to be back here. And what I wanted to do is to start with how many people are impacted by blood cancer. And if you need information or would like to join us on the superhighway to curing cancer, visit us at chicagobloodcancer.org or call us at 888-792-9992. You can also follow us by liking Chicago Blood Cancer Foundation on Facebook. And we are pleased to be joined by Dr. Swati Kulkarni. I'm going to get that right. She's a permanent breast surgeon and an expert in the management and treatment of breast cancer and benign breast disease. Dr. Kulkarni specializes in cutting-edge surgical breast procedures in addition to being an experienced clinician. Doctor is very active in research focusing on breast cancer, prevention, risk factor assessment. And Doctor, I want to thank you for joining us. And can you please help me with your pronunciation?
Sure. Well, thank you so much for having me. So it's Swati Kulkarni.
Kulkarni.
Yeah,
okay.
yeah.
Doctor, we hear the term all the time, breast cancer, and it's used all the time, but there are different types of breast cancer. And can you tell us the different types of cancer and how some of the diseases, how the difference in them?
Sure. So we used to think about 10 years ago that breast cancer was just one disease and we treated it the same way for everybody. But what we've learned in the last 10 years or so, and particularly in the past couple of years, we've learned that actually there are many different types of breast cancer. There are at least 4 main types of breast cancer, if not more. So the way that when we think of, there are some cancers, for example, I'll name some cancers, for example, like a common one that people might hear about is something called basal breast cancer or triple negative breast cancer. There's something called HER2 positive breast cancer. And those breast cancers probably make up about 25% or 30% of breast cancers. And then the remaining number of breast cancers are actually estrogen receptor positive breast cancers, and we categorize them into luminal A breast cancers and luminal B breast cancers. And these 4 types of breast cancers, we actually treat them in different ways, and they actually behave in different ways. So for example, most estrogen receptor breast cancers, patients tend to respond very well to anti-estrogen therapy, and whereas patients who have triple negative breast cancer, they don't respond to estrogen therapy, and they tend to respond better to chemotherapy. Okay, so and then HER2 positive breast cancer, we have a medication for that, and that's called Herceptin. And so they also differ in the ways that in terms of the prognosis. So
That was my next question too, as far as the incident and survival rate, and they're probably different too, as far as the rate of survival.
that's true. So overall, I think the key thing, and you touched upon it before, women who are diagnosed early with breast cancer, they tend to do very, very well. So women diagnosed with stage 1 breast cancer, over 90% of them are alive at 5 years. So that's very important in terms of screening and early detection. But when you're talking about these different breast cancers, you're right, they behave differently. So estrogen receptor positive breast cancers, in general, they tend to have a better prognosis. And some of these other breast cancers, such as HER2 positive breast cancers and estrogen and triple negative breast cancers, their prognosis is not as good.
And as far as the public awareness campaigns, we focus on a lot of middle-aged women, older women, but I wanted to just kind of touch just a little on some of the younger women, because we're seeing younger women getting breast cancer, and even men. You're probably seeing men in your practice now too with breast cancer. So if you could just touch a little in that.
Sure. So in general, I think as you said, breast cancer is a disease of older women, but there are certain younger women who are actually at very high risk of developing breast cancer, and those are women who may have a strong family history. So I think it's very important to know your family history. If your mother had breast cancer at a young age, or your grandmother, or your sisters, or even your father or your brother had breast cancer, if you have that type of history, you are at higher risk of developing breast cancer at a younger age. And generally there are some tests, some blood tests that patients can have to determine if they may develop breast cancer at an early age. For example, one of the more common ones is called BRCA1 and 2. So for example, if you have that it's called a mutation or abnormality in your genes, you are at very high risk of developing breast cancer at an early age. And those are the type of women.
And we hear that a lot too, like when people hear BRCA gene, that's what you're talking about. So,
So those are the type of women who it's very important that they get screened very early. We generally recommend, if they have that particular mutation, that they start screening in their mid to late 20s. And we recommend mammography and also MRI for those women.
Now, when you say, because a lot of times, if it's one, is it like one family member or two family members? Sometimes you look for how many family members there are to kind of give you an indication that you should be checked.
That's a good question. So, if you have a family member who's diagnosed at a very early age, so say your mother's diagnosed in her 30s, or you have that one family member, that would make you think, that might make you think that there might be a mutation in that gene or another genetic abnormality. But you can also have, if you see it in your grandmother, or that you have several relatives like your aunt, your cousins, but that if it's that early onset, that's one relative with early onset breast cancer.
And what would your recommendations be for like people when they should their chances of getting breast cancer? What would you say the percentages are of somebody who has like the BRCA gene and somebody who doesn't?
And I'm actually really glad you asked that question, because a lot of my patients ask me that when they come to see me. So someone with that BRCA mutation, and it's actually not that common. It's about 5 to 10% of women who have breast cancer have that mutation. Their lifetime risk of breast cancer can be up to 80%, 85% of developing breast cancer. Whereas someone who just has an average risk, their risk of developing breast cancer is about 12%. So that 1 in 8 number.
Yeah, and that's really a big difference. Yeah. So what would you, as far as like what should women do in terms of self-examination, checkups? Of course, we only have mammograms at this time. That's really like the first, first out of the gate and diagnostic test. So
Actually, right now, there's a little bit of confusion over the screening recommendations. So, a couple of years ago, the United States Preventative Task Force came out with these recommendations, and they recommended that women should start getting mammograms at 50, and then every other year. However, most of the major cancer societies, such as the American Cancer Society and the National Cancer Institutes and others, still recommend starting screening mammography at the age of 40, and also recommend a yearly clinical breast exam with their physician. And so those recommend. So I think the best thing is at age 40 is to you talk to your doctor and talk about your risk of breast cancer, because there may be other factors that are important in terms of what your risk is of developing breast cancer.
And there's, of course, I've talked to a lot of young girls too, and in any age group, what is the best time? Because a lot of times people are, self-examination, your body better than anybody does.
Sure.
So when you don't feel something right, or, you want to get that checked out. But what is the best time of the month? Because sometimes people are, women have their menstrual period, and what's the best time of the month to check?
Well, I like to answer that question in two ways. First, I think if you're going to do a self-breast exam, you should do it at the same time every month, because your breast changes when you're younger. As you said, sometimes, before your period and after your period, your breast can feel very different. So you should always do it at the same time every month. And if you're going to choose the best time to do it, it's probably best to do it right after you complete your period.
And again, every patient is different, but let's say you have a woman diagnosed with breast cancer. As a doctor, what are the factors and variables that you consider in terms of recommending treatment, and how do they weigh as far as what treatment you would go with?
So I think you have to look at each patient as an individual, and when we are thinking about treatment recommendations, we look at the type of tumor that we have. So we touched on that earlier in terms of the four main types. We look at the size of the tumor. If they have lymph nodes that we can feel or we can see on imaging. So we kind of take all of those things into account, and that's how we end up making our treatment recommendations. One of the things about breast cancer treatment is there are actually four main types of breast cancer treatment, and we can use those factors that I talked about: the size of the tumor, the type of the tumor, and whether there are lymph nodes. We use that information, and we can actually change the order in which we give the treatment, or we might add treatments or take them away or give them different amounts. So those are sort of the key things.
And what I've noticed too is now it seems like before they used to do surgery before radiation chemo, but it seems like now they're doing the chemo first before surgery. Is that to help shrink it so it would be easier to do surgical procedure?
So we do chemotherapy. So a lot of patients now are having chemotherapy before surgery, and that's one reason, as you mentioned, to shrink the tumor, to perhaps do a more cosmetically pleasing surgery. But the other reason to do it, and one of the reasons we do it a lot at the University of Chicago, is it's nice to see how the tumor responds to the treatment. Because if you think about it, if you give chemotherapy after surgery, the tumor's out, and you don't really know if that chemotherapy is working. So with the tumor in place, you can give chemotherapy, and you can actually see over time that the chemotherapy is actually shrinking the tumor.
Okay, that's good. Yeah. As far as genetics, because genetic testing we're getting into a lot of nowadays, and kind of futuristic.
Sure.
What about genetic testing with breast cancer? Like the rules, or how do you go about it?
So in general, some of the things that I talked about before in terms of the family history, that really drives the genetic testing. So in terms of if your mother or your sister, or you have multiple relatives with breast cancer or ovarian cancer, That's generally what triggers at least a referral to genetics.
Right. And it's just basically a blood test.
Exactly. It's
It's
just
a
a blood
very
test.
simple blood test. And explain staging to us, because that plays a big role in the treatment too of survival. How you stage. Some
Okay.
people don't understand that when
Okay.
the first thing you look at.
So for breast cancer, there are 4 stages of. So there's stage 1, 2, 3, and 4. 4 is breast cancer that's generally spread to other parts of the body. Stage 1 breast cancer means that the breast cancer is small, it's less than 2 centimeters, and it's isolated to the breast. And then stage 2 and stage 3 tend to be larger tumors with different numbers of lymph nodes that are positive.
And basically, as far as what testing, I mean, you do the mammogram or do ultrasound, or what testing do you kind of do as far as finding out what stage it is? I mean, what's involved in testing?
So we basically do the mammogram, the ultrasound, and if you have a large tumor, so like a tumor that's greater than 5 centimeters, or you have a lot of lymph nodes that are very suspicious. So only in that setting. So when you have a locally advanced breast cancer, we call it, that's when you would do additional staging with perhaps a CAT scan or a bone scan. But in early stage breast cancer, we do not recommend any additional staging beyond the mammogram and ultrasound.
And see, I hear so many women that are afraid. They're afraid to go in, they're nervous, and then they postpone their mammograms, postpone them. And I try to tell people too, because we talk to so many cancer patients, early diagnosis is the key to everything. So, because the real challenge with metastasized breast cancer is harder to cure.
That's absolutely right. So, as I mentioned earlier, early stage breast cancer, stage 1 breast cancer, if those patients, at 5 years, more than 90% of them are still alive and disease free. So that's extremely important. And once it has spread beyond the breast, it is much harder to treat. You're right.
And can you point out to our listeners a couple of good resources for accurate information about breast cancer and breast cancer treatments?
Absolutely. So the 2 sites that I refer my patients to is I very much like the NCI website, so the nci.gov. I think it has excellent information for breast cancer. And the other website that I refer my patients to is the nccn.org website. I think they have excellent information that's complete, accurate, and easy to understand for patients.
Okay. And now I'm going to ask you some things, because
Sure.
I know you would like to maybe explain something to our audience as far as like what you would want to tell our audience about breast cancer.
Sure.
And I'm going to let you have it here.
Oh, okay. So I think one of the things that I like to stress for patients that I see is, and my research interest is this as well, is I'm very interested in prevention. So because if we can prevent breast cancer, then then patients don't need to go through the treatment. They don't need to. So if they don't have to have the. And treatments. While they're very effective, they can have side effects. So that's my main interest. So one of the things that I like to talk about is things that women can do to be healthy, and I stress diet and exercise. I don't think we stress that enough. I know that sounds like a very simple thing, but a healthy lifestyle, I think, is the first thing I think is very important for breast cancer prevention. One of the other things I would like to also talk about, and I see this in my practice quite a bit, and a lot of my colleagues around in Chicago and around the country, we see is this I have this interest in women and the type of surgery they choose. And we've seen in the past 10 years that more and more women are choosing what we call bilateral mastectomy. And it's surprising to us because one of the things I didn't mention when you were talking in terms of treatment is, there's this, for many years, the only option for women was to have a mastectomy, and then we learned that actually breast conservation or a lumpectomy and radiation was just as effective, and so women could keep their breasts, and they would do just as well as a woman who removed their breast. But we've seen this increasing trend, and one of the things that I think it's important to know, and patients don't necessarily think about this or don't necessarily when they're thinking about breast cancer is that, when you have breast cancer in one breast, it doesn't necessarily travel to the other breast. And I think a lot of people don't know that. So if you have, treating the breast cancer that you have is what's going to improve your survival and reduce the chance of your breast cancer coming back. And to have surgery on both sides, unless, again, you have that genetic mutation. That's the one exception that I think, or if you have a very strong family history of breast cancer. But if you don't have that, having that additional surgery may actually put you at, risk of complications.
Right.
And it's
if
not
I could
help
just,
you.
if I could just say that my mother was a breast cancer survivor, and she actually had a single mastectomy because of the complications.
Right.
But they said her chances of getting it in the other breast were very, very slim. So
they are very low, and they actually there are statistics that patients may not know. Your risk of developing breast cancer in the opposite breast, if you don't have a genetic mutation, are about 0.5% per year. So it's very low. And now with some of the newer treatments we have for breast cancer, not only do these treatments treat the breast cancer, but they also reduce the risk of getting breast cancer in the other breast.
I believe we have a caller on the line.
Yes. Good evening.
Hi, your name is?
My name is Ray. You know what people say about something about death ready to happen? About death is waiting for you. Death is waiting for you if you don't do anything about it.
Oh, I see. In other words, if you don't do anything about, cancer, or do something about what's your chances of survival? I think he was trying to say. Yes.
So I think it's very important if you to number one, get your screening mammogram if you're in that age group that we recommended for it, and if you feel something on exam, it's very important not to let it go. Sometimes people are so afraid about finding out what the diagnosis is that they wait months and months and months before they come to see the doctor. And I think it's important, if you feel something, it's best, even if it ends up being nothing concerning, it's best to go in and see the doctor as soon as possible.
Yeah, and that's what we try to emphasize all the time. You know your body, you know how it feels. I mean, my mother felt hers, so it's better to get checked out, but it's very important, and again, doctor, that you get your checkups, because I know people are scared, but the longer they wait, the worse it's going to be.
That's right.
So, anyway, you want to just give us your information?
Sure.
Where we can, somebody can contact you, or if you want any information, they can contact you at.
Sure. So I work at the University of Chicago. I'm part of the breast program there. And the best way to reach me, I'll give you my phone number. It's 773-702-2028.
Okay, and I want to thank you again, Dr. I'm going to try it again, Kulkarni.
That's perfect,
okay,
yes.
Of the University of Chicago. Thank you so much for joining us here on Battling and Beating Cancer.
Thank you
for
having me.
We're going to bring Scott back, and our thanks. I wanted to say thank you to our law firm of Meckler, Bulger, and Tilson and Pearson, law firm specializing in business litigation. And remember, you can reach us at chicagobloodcancer.org, or you can call us at 888-792-9992. And now we're going to be joined by my other half, Scott.
Well, I have to tell you, fascinating, very informative, Charlene and Dr. Kulkarni. Thank you very much. And I think what we've learned, and what we're going to do in future episodes as well, is not only to get the specific information about breast cancer, and I think you got as much information as one can get in 20 minutes about it, but give you the tools that you need. And so apart from that, what we've learned tonight is how important it is to be educated as a patient, to be active in your care. And one of the most important things that you can do is get your hands in the best doctors that you can. And whether you live here in Chicago and you're watching on CAN TV 21 or anywhere in the world watching us on the internet, go to the best doctors. And when there's doctors like Dr. Kulkarni, and there's a few things you notice about her. One, she specializes in the area. Two, she's a clinician and a researcher and very well versed. But also, apart from her technical skills and knowledge, very approachable, good explanations. You want a doctor that you can communicate with, who will have your best interest in heart, who you can ask questions, weigh options with. That makes all the difference. And of course, because selecting the best treatment for your cancer is critically important. And those are some of the long-term tips to survival. So this was our first show. Next week on the program, we're going to have Dr. Stephanie Gregory from Rush University Medical Center. She's one of the top hematologists, oncologists in the world. She's going to be talking about lymphoma, which is a type of cancer I had, and then the following week she'll be back to talk about leukemia. So those are some of the upcoming shows that we have. Our thanks to Dorothy, to Christy, our wonderful executive producers. Our thanks to Dr. Kulkarni, and our thanks to you for joining us. And we'll see you next week, same time, on Battling and Beating Cancer. Good night and good health, everybody.
Good night.